Hello everyone. So here we are going to start with the topic of brachial plexus. So it's a very important topic of upper limb, and here I am going to discuss the formation of brachial plexus, what are the components of brachial plexus and what are the branches of each component of brachial plexus, and also with the important nerves lesions. So we will also discuss about brachial plex injury, both upper and lower plex injury, and also with the important nerves being involved in important injuries. So let's discuss with the topic. So first thing which I want to elaborate here is the formation of brachial plexus. Okay, so when I am talking about the formation of brachial plexus, it is a nerve plex. Okay, if I talk about the word plex, what does that mean? It means it's a bunch of nerves. So it's a plexus or network of the nerves which is residing. So if I talk about its cords, the cords of brachial plexus is residing in the axillary region, and if I talk about its roots and the trunks, it is residing in the neck region. Okay. So basically, if I talk about brachial plexus, it's a network of nerves which is giving innervation to the skin and also the muscles of upper limb. So it starts forming in the root of the neck. The formation starts in the root of the neck, and thereafter it traverses through the axilla and run through the entire upper extremities. Okay, so let me just show you this image. I want to enlarge this image where you can see the brachial plexus. So here these nerve plexus, as you can see, if I want to show you the trunks of the brachial plexus, you can see in this diagram that the trunks of brachial plexus is traversing between the scalenus group of muscle. Which scalenus group of muscle? That is scalenus medius and anterior. So brachial plexus is coming out between scalenus medius and that of scalenus anterior muscle. So it is traversing between these two muscles. So both roots, what do you mean by the root? The nerve root which is forming the brachial plexus, both roots and the trunks of brachial plexus is residing in the neck region. Now, so let's talk about the formation. So if I talk about the formation of brachial plexus, so primarily it is formed by the ventral rami of C5, C6, C7, C8 and T1. So I want to come to this image. Before that, I just want to show you this. Okay, so when you see this diagram, you can understand the formation of brachial plexus. So see here, these are the nerve roots. Okay, C5, C6, C7, C8 and T1. So these are nerve roots. The ventral rami of, so if I talk about ventral rami, the ventral rami of, the word ventral rami means anterior rami. The ventral rami of the cervical nerves and the first thoracic nerve together forms the root of brachial plexus. Now, in this diagram itself, what you can appreciate, the roots of brachial plexus again joins to form the trunk. So, here's. So, what you can see here that the C5 and C6, okay, if I talk about C5 and C6, the C5 and C6 will join to form the upper trunk. Okay, the C7 alone will form the middle trunk. The C8 and T1 will join to form the lower trunk. Okay, so here very nicely you can appreciate C5 and C6 together joins to form the upper trunk. The C7 alone continues to become the middle trunk. C8 and T1 will form the lower trunk. Now, each of these trunk will divide into division. Each of this trunk will divide into division. The upper trunk divides into anterior division and the posterior one. So this goes for each of the trunk. So here we can see blue color is showing the anterior division of each trunk and yellow color is showing the posterior division of each trunk. Now, if I talk about the formation of cords, how you can appreciate that the anterior division of upper and the middle. So what are these? These are the divisions. So anterior division of upper and middle will form the lateral cord. Anterior division of upper trunk and the middle trunk, if joined together, it leads to the formation of lateral cord. Got it? Now, if you will see the posterior division, so see here, this is the posterior division of upper trunk, this is the posterior division of middle, and this is the posterior division of lower trunk. These three together will join to form the posterior cord of brachial plexus. What about the medial cord? The anterior division, see here, this is the anterior division of the lower trunk. The anterior division of lower trunk will continue becoming the medial cord, of brachial plexus. So, okay. So very nicely you can appreciate this. By seeing this diagram, you can appreciate the formation of brachial plexus. So that means the important components of brachial plexus is the roots, is the division and the trunks and the cords. It is important to know how the roots is formed, how the cords are formed, what is the location of different component of brachial plexus, and it is also important for you all to know the branches of each component of brachial plexus. For that, I will give you the mnemonic to know this. So before that, let's see. So yes, in this diagram you can appreciate, so let me slightly enlarge this image. So when I am enlarging this image, you can clearly appreciate that the roots of brachial plexus. So normally the roots of brachial plexus is formed by anterior rami, which is also called as the ventral rami of C5, C6, C7, C8 and T1, and it is located in the neck region. The trunks. So we have just seen the C5, C6 will join to form the upper trunk, C7 will form the middle and C8 and T1 will form the lower trunk. So the trunks of brachial plexus is again residing in the neck, and the trunks of brachial plexus will come out by passing between the gap of scalenus anterior and scalenus medius muscle. Now each of these trunks will divide into divisions, anterior and posterior, and will ultimately lead to the formation of cords of brachial plexus. How many cords of brachial plexus we have got? We have got 3 cords of brachial plexus, the medial, the lateral and the posterior. And if you remember the relations of second part of axillary artery, there we have already described that the cords of brachial plexus are related according to their name. That means lateral cord will be related lateral to the second part of axillary artery, medial cord will be related medial to second part of axillary artery, and posterior cord will be related posterior to second part of axillary artery. A good point is that there is no branches from the division, and we have to memorize the branches of trunk, we have to memorize the branches of cords and that of the roots. Now one more thing is very important. Just now we are knowing that the division, if I talk about the location of division, we have got each of the trunk is dividing into anterior and posterior division, and the division is located behind the clavicle. So it is located behind the clavicle. That means supraclavicular branches of brachial plexus is the location of the component of brachial plexus which is lying above the level of clavicle is the roots and the trunk, and infraclavicular will be the divisions or will be the divisions and the cords. Basically division is exactly behind the clavicle. If I exactly talk about below the location of the clavicle will be the cords and its branches. So yes, if you will see this enlarged image, what you can see, the nerve roots and the trunks are located above the level of, so see here, this is the clavicle which I am highlighting, the collarbone. So you can see here both the nerve roots and the trunks are lying above the clavicle, but the location of cords of brachial plexus, is below, and the location of division is exactly behind the clavicle. That means the branches of cords of brachial plexus is residing infraclavicular in location. Got it? Now, before proceeding to the individual components and their explanation, I would like each one of you to just focus on this. Okay, each one of you please focus on this brachial plexus and their components. Okay, so when I am talking about brachial plexus, normally if I talk about brachial plexus, its normal formation is by the ventral rami or anterior rami of C5, C6, C7, C8 and T1. But my dear aspirants, at times what happens, it can be prefixed and postfixed. Now the important point is that when we are telling the brachial plexus is formed as prefixed, and when we are telling the brachial plexus which is formed as postfixed. Now, if the brachial plexus is formed and it is taking contribution from C4 component, that is cervical nerve root C4, then it is called as prefixed. If the brachial plexus is formed and it is formed by taking contribution also from the second thoracic, that is T2, it is called as the postfixed brachial plexus. Let me enlarge this image and show you this diagram. So all of you just focus on the prefixed one. Okay, so just see this diagram where the prefixed brachial plexus has been shown to you. So can you appreciate here the brachial plexus is formed by taking contribution from C4, C5, C6, C7, C8, and very minor contribution will be taken from the T1. Okay, so if the contribution of C4 is prominently taken in the formation of brachial plexus, these type of brachial plexus is called as prefixed brachial plexus. Now let me show you the other image where you can see the image of post-fixed brachial plexus. So when you see this image, that is the post-fixed brachial plexus, you can see here that the formation of brachial plexus is taking contribution from T2 also, along with C5, C6, C7, C8, it is also formed by taking contribution from T2. So this kind of brachial plexus formation is called as post-fixed type of brachial plexus. So done with this. Now, thereafter, after understanding the formation of brachial plexus, I also want you to, before proceeding with the branches of each individual component of brachial plexus, I want you to give the concept of ventral or anterior rami. It is very important that you should understand what is ventral rami and that of anterior. Already neuroanatomy is not completed, so I want you to understand this. So roots of brachial plexus, what I have told that it is formed by anterior rami of the cervical spinal nerves. So for understanding that, I would like to enlarge this image. So when I am enlarging this image, you can understand how the spinal nerves are formed. So in this diagram, you can appreciate that dorsal nerve root zone, this is the dorsal nerve rootlets. So always dorsal nerve rootlets will be sensory. Okay, when I am talking about ventral nerve rootlets, they are motor. That means one spinal nerve. Okay, also appreciate that dorsal nerve root will contain dorsal root ganglia. They are sensory or afferents and they will join with the efferents, that is the ventral roots, which is motor. That means the joining of dorsal nerve root and the ventral nerve roots takes formation of spinal nerve. After the formation of spinal nerve, the spinal nerve diverges anteriorly and posteriorly. So when it is going posteriorly, it is called as dorsal rami, which is basically giving innervation to the back muscle. Ventral rami will give innervation to all of the upper limb, lower limb and anterior aspect of the body. So this is the concept of ventral ramus and that of dorsal ramus. So it is quite clear that brachial plexus, which is very important nerve network, which is giving innervation to upper limb muscle and also giving cutaneous sensations, innervation is formed by ventral ramus of the spinal nerve. And by seeing this diagram and by understanding the formation of spinal nerve by joining dorsal nerve rootlets and ventral nerve rootlets, it's quite clear that always the spinal nerves are mixed variety. When we are talking about cranial nerve, either it is of motor variety or either it is sensory or some of it is mixed variety. The concept should be clear that we have got 31 pairs of the spinal nerves and all of them are of mixed variety, having both sensory and motor component. Okay. Now, okay, let me just enlarge this image. So when I am enlarging this image, actually this is brachial plexus. Okay. So here why I have not labeled anything, because I want you to understand the components and the parts of brachial plexus and the branches of individual part. Because the scene is that in अगर हम अभी के trends के MCQs देखें तो they ask you image based MCQs and it is important that you should be able to locate each of the branches of brachial plexus. So we will firstly understand the individual branches of each components and then we will proceed with the mnemonic of each components. Okay. So let's see. Here this is C5, this is C6, this is C7, this is C8 and T1. So these are ventral rami. So what I have written is ventral rami of C5, C6, C7, C8 and T1. So what is that? This component is roots of brachial plexus. Roots of brachial plexus. So from roots of brachial plexus we have got two branches. One is DS and the other is this one LTN. So here I will write in small. So here DS stands for dorsal scapular nerve and LTN stands for long thoracic nerve. So basically we have got two major branches from the root component of brachial plexus. DS, that is dorsal scapular nerve, giving innervation to rhomboidus major minor levator scapulae muscle. Long thoracic nerve, which is also called as Bell's nerve or nerve to serratus anterior, giving innervation to serratus anterior muscle, the muscle of the medial wall of the axilla. Now, the next component of brachial plexus is trunks of brachial plexus. So when I am talking about the trunks of brachial plexus, in this diagram, you can clearly appreciate that C5, okay, just see here, this is C5 and this is C6. So, C5 and C6 will join to form. What is this? This is UT for upper trunk. C7 alone will form the MT, that is middle trunk, and C8